Please pay attention to this video. This could be a lifesaver. You should immediately check your blood sugar levels if you have these diabetes symptoms. You always get tired. Two common reasons for tiredness or lethargy are having too high or too low blood sugar levels. In both cases, the tiredness is the result of having an imbalance between one's level of blood glucose and the amount or effectiveness of circulating insulin. If you feel tired during the day despite having slept well, it could be a result of either high or low sugar levels. It is best to test your blood glucose levels to see whether the tiredness is indeed a result of having high or low sugar levels. Frequent urination. Are you visiting the bathroom much more lately? Does it seem like you urinate all day long? Urination becomes more frequent when there's too much glucose in the blood. If insulin is non-existent or ineffective, the kidneys can't filter glucose back to the blood. They become overwhelmed and try to draw extra water out of the body to dilute the glucose. This keeps your bladder full and it keeps you running to the bathroom. Sharp or sudden weight loss. In people with diabetes, insufficient insulin prevents the body from getting glucose from the blood into the body's cells to use as energy. When this occurs, the body starts burning fat and muscle for energy, causing a reduction in overall body weight. Unexpected weight loss is often noticed in people prior to a diagnosis of type 1 diabetes, but it may also affect people with type 2 diabetes. If you have unintentionally lost more than 5% of your normal body weight, or more than 10 pounds in 6 to 12 months or less, you should consult your doctor. Your wounds not healing. People with diabetes are at increased risk for complications from wound healing for several reasons. First, diabetes decreases blood flow, so injuries are slower to heal than in people who do not have the disease. Second, many people with diabetes also have neuropathy, reduced sensation in their hands or feet, which means they don't necessarily notice an injury right away. You always feel hungry. Okay, so why do diabetes patients get hungry often? It is easy to understand why you feel so hungry when you have low blood sugar, but how do you get hungry when you're overloaded with sugar? That's what diabetes is all about. What happens is high blood sugar does cause hunger, even though you do not need more food. This is because every cell in your body relies upon insulin to get the sugar from the blood. If there's not enough insulin, or if it isn't working properly, sugar piles up in the blood, but it can't get to the cells where it's needed. So the cells send the signal to the brain to get more food. And because this is happening all the time, you tend to feel hungry constantly. You're having sexual problems. Both men and women with diabetes may lose their sexual desire when their blood glucose levels are high. Reduced blood flow and nerve damage to the penis are generally the underlying reasons for erectile dysfunction for men with diabetes. Often, men with diabetes who have the condition also have other complications related to nerve damage or blood circulation problems, such as high blood pressure, high cholesterol, or heart disease. The main sexual problems that women deal with are vaginal dryness, a decrease in sexual desire, pain during sex, and trouble having an orgasm. Women with poorly controlled diabetes are more likely to have frequent yeast infections. Keeping blood glucose levels under control will help overcome this. Having blurred vision. High blood sugar causes the lens of the eye to swell, which changes your ability to see, blurred vision. To correct this kind of blurred vision, you need to get your blood sugar back to the target range, 80 milligrams per deciliter to 140 milligrams per deciliter before meals, and 100 milligrams per deciliter to 160 milligrams per deciliter before bedtime snack. It may take as long as 3 months after your blood sugar is well controlled for your vision to fully get back to normal. Blurred vision can also be a symptom of more serious eye problems. If your vision is blurred, contact your doctor. Having vaginal infections. Women with diabetes are at higher risk for developing vaginal infections than women without diabetes. And in addition, if the woman's diabetes is not well controlled and her blood sugars are constantly high, this creates an environment of high sugar in the mucous membranes, a good environment for the overgrowth of both bacteria and yeast. Symptoms of vaginal infection are itching of the vagina and vulva, often associated with a discharge from the vagina. Tingling in hands and feet. If you have had diabetes for a few years, you may start to notice numbness or tingling in your lower legs or feet. This is neuropathy. Neuropathy is a long-term complication of diabetes. Over many years, glucose can damage the blood vessels and nerves in the feet, lower legs, and hands. Numbness and tingling, sensitivity to touch, or muscle weakness may develop. Sometimes you can control your blood glucose levels, but neuropathy will still develop. The longer you have diabetes, the higher the risk of developing neuropathy. You always feel thirsty. Hyperglycemia is the reason that diabetics experience excessive thirst. Your kidneys act as a filter and normally absorb the glucose in your blood and recycle it for your body's use. When your blood glucose is high, your kidneys cannot absorb all the sugar. Instead, the excess sugar is dumped into your urine, and your body tries to flush it out of your system by producing more urine. The increased urine production and resulting dehydration causes you to be extremely thirsty.